Total knee replacement really is a misnomer, or we really should call it a knee resurfacing, because we're really not taking out much bone. I found that a lot of patients have a misconception that we're cutting the femur way up here and cutting the tibia way down here and taking out the entire knee joint. Well, that's far from the truth. We're taking what little cartilage is remaining with a little bone, and we're shaping the end of the femur with these instruments that allow us to do it very precisely. After we've made our cuts, what we have is something that looks like this. You can see you've got a lot of bone left, but we've shaped the bone to match the geometry of the prosthesis, and the tibia is cut flat. We then machine these holes in there for part of the prosthesis. Once we have the bone shaped like we want it, we put in what's called a tibial component, and that's generally made out of titanium. And then the femoral part, likewise, is put on with a bone cement. It takes about 10 minutes to cure and harden. We also resurface the back of the kneecap. I often get asked about partial knee replacements. Am I a candidate for partial knee replacement? And if one has arthritis just on one side of the knee and the rest of the knee is normal, then one may be a candidate for partial. Patients want to know how long it will last them. And it varies depending on their activity level, their weight. I can't tell you exactly, but we think they're going to last 15, 20 plus years. The rehab is very important in knee replacement. The patient has to move it early, and it's not comfortable. And the therapy generally will last for 4 to 6 weeks. In some patients, they need more, some people need less. But the physical therapy and the patient compliance with the therapy is extremely important.